The emergence of Omicron is stepping up pressure on President Biden and his administration. During his remarks from the White House yesterday, the president urged caution, but stressed this is not the time to panic.
This variant is a cause for concern, not a cause for panic. We'll fight this variant with scientific and knowledgeable actions and speed, not chaos and confusion.
Now, the president also continued a push for vaccines, of course, saying that shots are the best way to protect yourself. So Nancy Cordes joins us now from the White House with more on this. So Nancy, one of the first things that this administration did do, though, was announce a travel ban on 8 countries in southern Africa. And the administration has taken some criticism for that, because the reality of it is, as we know, Omicron is most likely already here. It's certainly spread beyond southern Africa. And many argue that travel bans are ineffective. And, you know, Vlad pointed out just the other day that the infection rate is higher in many of these European countries than they are in some of these southern African countries where the travel ban are imposed. Now, I understand that we are talking about probably Delta, and we have a thorough understanding of Delta, don't know very much about Omicron. Still, you know, how is the president and the administration defending their decision to impose these travel bans?
Well, I think White House officials from the president on down, Anne-Marie, have had a little trouble explaining the policy rationale behind the decision. Obviously, there's the optics rationale, which was that there were several European countries that right off the bat shut their borders to travelers from these countries in southern Africa. And clearly, the White House did not want to look as if it was not taking action itself. But from a policy perspective, the president argued yesterday that this had to be done to buy time for Americans to get vaccinated, knowing that Omicron was coming this way. Well, you know, Americans have had more than a year now, in many cases, to get vaccinated. So, you know, 2 more weeks or 3 more weeks, if they haven't done it at this point, may not be the answer. He also said that there was a large concentration of the Omicron variant in South Africa that was the reason for shutting the borders. Well, you know, we frankly don't know whether there are just as many cases that are related to this variant here in the U.S. at the moment as the scientists had discovered there were in South Africa. Nevertheless, this travel ban has been imposed. White House officials have not said whether it's going to last a couple of weeks, a couple of months. We know that South African officials are very frustrated, and frankly, globally, there are policy experts and officials who say that what the U.S. and dozens of other countries at this point have done, it does not send the right message. You had the UN Secretary General arguing yesterday that it essentially penalizes South Africa and some of these other countries from doing good science and coming forward and sharing their data with the rest of the world. And they worry that it will discourage other countries in the future from doing the same thing.
Yeah, it's sort of tough, I guess, Nancy and Anne-Marie. On one hand, if the president doesn't do something like this, then 6 months down the line or 3 months down the line, if Omicron turns out to be, you know, God forbid, something worse than what we've already experienced, that will become a criticism. If it turns out to be nothing, that will also be a criticism, that he did this knee-jerk reaction in imposing this travel ban, and people are going to say, you see, it was much ado about nothing. So from a just not talking public health here, just politics-wise, it's a tough position for the White House to be in. And we've seen some forms of lockdowns, Nancy, returning in parts of Europe. The president was very clear yesterday that at least is off the table. What are you hearing about further measures?
Right. The president did say that at this point, he doesn't anticipate that any major new public health measures will have to be taken. So when he says that, he's referring, you know, not just to lockdowns, but new mandates and things like that. And that is because doctors like Anthony Fauci, who is advising the president, are saying that while we still don't know all the ins and outs of Omicron, whether it is more virulent than the Delta strain, for example, whether it's more transmissible than Delta, they assume that the current vaccines will have at least some effectiveness against this new variant. Now, there were some troubling comments from the CEO of Moderna, of all people, to the Financial Times. According to the writer of that article, the CEO of Moderna told him he's worried, and that the scientists he talks to are worried, and he feels that almost certainly there is going to be a degradation of the effectiveness of the Moderna and Pfizer vaccines against this particular variant, and that it's going to take months to come up with a new vaccine that would be more effective. And so when you hear that coming from Moderna itself, that is troubling, and I think highlights the fact that we are still sort of in this gray area where we don't really know how effective the current batch of vaccines will be against this variant, and it's probably going to take another few weeks before we have that information. And so it gets back to the point you were making, Vlad, about whether the White House is doing too much or whether it's doing too little, and what the, how its actions will be seen months from now. That's what's so difficult for White House officials right now. They want to be seen as taking action, as being on top of this, but they really don't know what they're up against right now. So they're trying to do things to show that they're going to stay on top of this, but at the same time, it's really hard to know right now what the right actions are to take.
And, speaking of doing too much or doing too little, scientists around the world, around the globe, have warned that in the wake of vaccine inequity, we're going to see the emergence of new variants. South Africa doesn't have a problem with accessing the vaccine that they need, but they have a very low vaccination rate. But a number of the other countries in Southern Africa have said, we need more vaccine. What is the U.S. doing to help boost vaccination rates in some of these developing countries?
Well, the U.S. has donated millions of vaccines and is vowing to donate millions more. But I think one of the big lessons of this pandemic is that it is not enough to just provide vaccines and say, here you go. First of all, many countries don't have the infrastructure to provide the cold storage that the Pfizer vaccine in particular requires. Those super cold refrigerators where you need to be able to store the vaccine so it doesn't go bad. That is one big problem. That's not a problem in South Africa, but South Africa still has a very low vaccination rate because delivery of the vaccines is also a problem. I'm not even talking about vaccine hesitancy, which, as you point out rightly, Anne-Marie, is a big problem, but also just the mechanisms to get the vaccines into arms. Here in this country, we had a year to kind of ramp up and plan for how we were going to deliver using, the current public health infrastructure, going to quickly deliver vaccines to millions and millions of Americans. What products did we need? The syringes, the needles, where were we going to do it, and how were we going to do it, and doctors and nurses and all the rest. In some of these countries, that has turned out to be the big bottleneck, to the point where they have turned away vaccine. They've said, we got plenty of vaccine, don't send us any more. Our problem is getting vaccines into arms. So that is really a reminder to wealthy nations like the U.S., hey, it's great to donate these vaccines, but you've also probably got to help some of these third world nations in particular prepare to deliver the vaccine in a timely fashion as well.
It's such an important point, Nancy and Anne-Marie. Again, just thinking back to how we as a planet were able to defeat other really deadly infectious diseases like smallpox or polio. When I was a kid, I remember seeing, commercials, for example, for the Peace Corps, and showing the Peace Corps helping countries in less fortunate places than the United States vaccinate young people and adults. And you just don't see that as much anymore. Maybe it's happening, and it's just perhaps, not front page news, but perhaps that needs to be there needs to be a greater focus on that. And hopefully the president hears that message from other world leaders who are imploring the United States to help with this, because if we are, as a country, are able to do that, then we all benefit. Nancy Cordes For us at the White House, as always, Nancy, love you. Thank you.
You got it.